At 2:17 a.m., a mother sits on the edge of her child's bed, watching his chest rise and fall, counting each breath, like it's a promise she's afraid might break. His blood sugar drops, and she moves quickly, practiced. Juice box, glucose tabs, the routine they've memorized, not by choice, but by necessity. On the kitchen counter sits a small vial of insulin, and she asks herself, how long can I make this last? And for some families, that question doesn't stay hypothetical. According to ABC News in 2020, a mother named Nicole Smith-Holth lost her son Alec because she couldn't afford his insulin. Just 3 days before payday, she rationed it to make it last. But unfortunately, he died from diabetic ketosis. The Mayo Clinic proceedings in 2025 advises that insulin, a life-saving drug for those with diabetes, can cost anywhere between $200 and $400 per vial, when the manufacturing cost sits at $2 to $4. While this might seem like a small problem, according to Health Policy and Planning in 2024, nearly 2 billion people globally have no access whatever to life-saving essential medications, with cost often being the primary factor. And that number doesn't include those who struggle to afford their medications due to high costs. Our federal government must regulate pharmaceutical drugs to prevent the price gouging of essential medications. So today I will first expose the causes, second I will talk about the effects, before lastly discussing some solutions. Because when a mother has to have a moment at 2:17, it's not a medical problem, it's a pricing decision. So let's talk about what's causing this. There are two causes that we need to consider: lack of government oversight and patent protections. First, let's talk about lack of government oversight. In the United States, there are very few direct limits on how high pharmaceutical companies can set their prices. Unlike many other developed countries, the US relies largely on market value forces rather than strict government price controls. And this lack of regulation causes Americans to pay significantly more for basic medications that people in other countries get for significantly less. According to a 2024 RAND study, US drug prices are about 2.78 times higher than those in 33 other developed countries. And without this crucial oversight, the prices will keep rising, with little to no interference. According to the Academy of Managed Care Pharmacy 2025, between 2022 and 2023 alone, over 4,200 drugs increased in price, and nearly half rose higher than inflation. As a result, Americans have to make these difficult choices of skipping doses or going without medication entirely due to cost. Ultimately, the lack of government oversight allows pharmaceutical companies to prioritize profit over patients, making essential healthcare inaccessible. Now, let's look at patent protections leading to market manipulation. Patent protections are designed to encourage innovation by giving pharmaceutical companies exclusive rights to sell a drug for a certain period of time. However, in practice, these protections are often extended or manipulated to block competition. According to the Federal Trade Commission 2024, some companies engage in practices like improperly listing additional patents, which can delay cheaper generic alternatives from entering the market and keep drug prices artificially high. In fact, research using an IQVIA data on drugs approved between 1995 and 2017 shows that brand name manufacturers often hold dozens of these patents on one single drug, extending their monopoly far beyond the original patent period. And these strategies can delay generic competition for years. The impact of these patent protections is significant because generic drugs are much more affordable. And according to a 2026 report from the US Food and Drug Administration, generic medications cost 80 to 85% less than the brand name drugs. Yet, these lower cost options are frequently kept off the markets due to these patent protections. The Loan Institute in 2022 further reports that when individuals are not able to afford these essential medications, they will stretch their doses out, skip them entirely, delay refills, or take less than what is prescribed. When you combine a lack of regulation with a system designed to eliminate competition, you get consequences. Some that happen at the end of your child's bed. Which bring us to our effects. We have two to look at: medication rationing and financial hardship. Medication rationing is one of the most dangerous and immediate consequences of pharmaceutical price gouging. It directly turns a treatable condition into a life-threatening one. According to the Journal of American Medical Association in 2023, about 1 in 5 adults under 65 with diabetes report rationing their insulin due to the high costs. It's not rare, it's widespread. And as we saw with Nicole Smith Holt's son, it can also take one's life. Additionally, the American Journal of Managed Care in 2026 showcases that many studies have documented cases where young adults have died after rationing insulin when they could no longer afford it, proving that this is not theoretical, it's already happening, and further suggests that if there's no change to a price gouging, an estimated 1.1 million Medicare patients will die over the next decade because they cannot afford their prescription medications. That is about 100,000 deaths per year. And it's clear that when we talk about price gouging, we're not just talking about high prices. We're talking about a system that pushes people into dangerous behaviors just to stay alive. And now we'll talk about our next point about financial injustice and inequality. The consequences of pharmaceutical price gouging also cause financial hardships and inequalities that disproportionately impact vulnerable populations. The burden of choosing between prescription drugs and basic necessities is not evenly distributed, and low-income individuals, the uninsured, and those with chronic conditions are far more likely to experience financial strain due to the rising drug prices. As a result, healthcare inequality continues to widen, with wealthier individuals maintaining consistent access to life-saving treatments while others fall behind. In many cases, patients are forced into medical debt, which can lead to financial instability, damage credit, and even cause bankruptcy. According to the American Journal of Public Health in 2019, about 66.5% of bankruptcies are linked to medical issues. And according to the Kaiser Family Foundation in 2022, 100 million Americans have medical debt. Furthermore, the stress associated with financial hardship can worsen these conditions, creating a vicious cycle in which the sick remain sicker, and those who cannot afford their medication end up requiring more intensive care and encourage even greater medical expenses. This cycle reinforces systemic inequality and highlights how pharmaceutical price gouging is not just a healthcare issue, but it also widens our social and economic injustices. The question, how long can I make this last, should never have to be asked in the first place, so let's prescribe some real solutions. There are two solutions to price gouging. First, a legislative solution, and then a personal solution. Luckily for us, there is a legislative bill that has just been introduced in Congress, SR 2044, and Price Gouging for Medications Act. We cannot allow companies to charge ridiculously high prices for medications that are essential for people to live. According to Congress website in 2025, this bill would establish reference pricing for prescription drugs, creating a standard to prevent the kind of extreme markups that are harming Americans every day. Even more importantly, those prices would be based on what other developed countries are paying, where the same medications are often sold for a fraction of the cost. This is where we come in. Change doesn't just happen in Congress. It happens when people demand it. You should reach out to your representatives and urge them to support this bill. Next, let's look at some real personal solutions that we can utilize today. Legislative change is crucial, but in the meantime, we can start by being more informed and using other resources out there. First, you can start by asking your doctor or your pharmaceutical provider, are there any cheaper alternatives to this medication or a generic brand that I can use? Or if you want to go onto Science, according to Science Direct in 2025, prescription drug cost-saving platforms like GoodRx and Mark Cuban's Cost Plus Drug Company have emerged specifically to help patients compare prices and reduce the cost of medications, and they even provide coupons. Lastly, you must know what is on your own campus, and you take advantage of the resources that are already available to you. Many college campuses offer free or low-cost health services, basic medications, and wellness supplies that are already paid for by your tuitions and fees. Start asking the questions, start using the resources, and advocate for yourself and the people around you. Nicole Smith Holt didn't have to lose her son, but pharmaceutical companies chose profit over people. So the real question is, are we going to keep letting this happen? Today, I first exposed the causes, second, I talked about the effects, and I finally discussed some solutions. It is important that our federal government regulates pharmaceutical drug prices to prevent price gouging of essential medications. So tonight, somewhere, another parent will sit on the edge of her bed at 2:17 a.m., watching, waiting, doing everything right except having enough money. And on that same kitchen counter will sit a small vial of insulin, not just as medicine, but as a countdown. How long can we make this last? Is a question that no parent should ever have to ask. thing that should be running out of time is pharmaceutical price gouging.